afternoon. My name is Dr. Jennifer Connie Mckinney, and I'm a lifelong Kansan. I was born and raised in Fredonia, Kansas, where I've been a family physician for the last 12 years and also the county health officer. I practice medicine alongside my father, who is 77 years old and has served our community for the last 42 years. I am a mom of an 8-year-old son and a 10-year-old daughter. My partners and I staff the emergency department, clinics, and hospital. We care for patients in nursing homes, in the parking lot, through telehealth, or in their homes. We go wherever they need us. We're swabbing noses. We're putting on and taking off PPE every day. We're educating others and keeping ourselves educated on the latest data and science. I'm here representing others out there like me. I'm your neighbor, your sister, your friend. I'm your family doctor who you've trusted for years to treat your kids or maybe your parents for their acute illnesses, their diabetes, a broken leg, maybe depression. I was educated right here in Kansas to help you through the challenging times. We are now in one of the most challenging times we've ever experienced. Our healthcare workers in rural clinics and hospitals like mine are caring for patients the best we can with staffing shortages and limited supplies of life-saving medications, while the larger hospitals are doing the same, but are filled with critical patients. Recently, my practice partner had to call 35 different hospitals in different states to find an ICU bed for a patient actively bleeding. While working for 28 hours to transfer this patient to a larger hospital, the doctor and medical staff cared for the patient until they were able to transfer her to the critical care she needed with the necessary staffing. This is a common story these days. Never before have we seen how much our rural and urban communities and healthcare systems are interconnected. Never before have we seen them all so overwhelmed. The more contagious Delta variant is spreading like wildfire through our communities. And as our schools welcome back our kids, many of whom, like my own, are too young to be vaccinated at this time, they depend on us in the community to protect them in every way we can, by getting vaccinated, wearing masks, social distancing, getting tested, and staying home when we're not feeling well. Unfortunately, we are witnessing people not doing these basic things to protect each other. We have the tools, we just need to use them. As a member of our local school board for the last 6 years and former president of the school board, we promised to make our decisions based on what would be best for our kids' health, safety, and education. As a child growing up in my small town in Kansas, I never had a doubt that people were making good decisions to keep me safe. These are our small town values. They're really our Kansas values: protect, respect, and trust one another. I worry about my children every day. I worry about your children every day. The same science that we teach our kids in our schools is being ignored in our communities. This science, for example, shows that masks and vaccines are safe and effective. Every healthcare professional I've spoken with is discouraged and exhausted. For me, this sometimes means sitting in my office at the end of a long day and just having a good cry. Somehow politics, threats, and misinformation have gotten in the way of that promise we had to our children to keep them and each other safe and healthy. I ask that each Kansan go back to our values, protect each other, respect each other, and trust in each other. We are Kansans and we care about our communities. We've always risen to meet the challenges throughout history. I ask that we see the over 4 billion people worldwide who are living proof that these COVID vaccines are safe and effective at preventing hospitalization and death. I am vaccinated. My family's vaccinated. My kids are ready to be vaccinated as soon as they can be. I would never ask you to do something I wouldn't do myself. I ask that you please do something, just something. Stay home when you're sick. Wear a mask, get vaccinated, quarantine or isolate when you should, social distance, get tested. We all have choices. I ask that you please choose to do something to help yourself and those around you. The only way we'll get out of this challenging time is to do it together. Thank you, Governor Kelly, for your efforts and for allowing us to be here today. With that, I'd like to introduce Dr. Stephanie Coleman. Dr. Coleman is an associate professor of pediatrics at KU School of Medicine in Wichita. She is the Division Director of Hospital Medicine for KU Wichita Pediatrics and the Pediatric Medical Director for Wesley Children's Hospital. She is also the facilitator of the Kansas COVID Work Group for Kids. Thank you, Stephanie.
Thanks, Dr. McKinney. I think it'll be tough to follow that, but thank you. As Dr. McKinney said, I'm Stephanie Coleman. I'm a pediatric hospitalist physician, and more importantly, I am the mother of 2 young children. I'll take this off to speak. 2 school-age children, and also a member of the Wichita community and an advocate for our community of Wichita. So first, I'd like to thank Governor Kelly for being here today, for being in Wichita today, and specifically for being here at Wesley Children's Hospital. Thank you, Governor, for your relentless effort to lead our state during this pandemic. Also, thank you for your support and advocacy for the frontline first responders and healthcare workers throughout our state. And also, thank you for your commitment to keep the children of Kansas safe. We appreciate all that you're doing. 5 years ago today, we celebrated right in the same spot the opening of Wesley Children's Hospital. We pledged our commitment to provide the specialized pediatric medical and surgical care and services to the children of Wichita and our surrounding communities. We have cared for countless families from across Kansas and northern Oklahoma during these last 5 years. I want to thank all of our hospital administration, staff, workers, team members in the pediatric hospital. I especially want to thank my colleagues with KU Wichita Pediatrics, my fellow hospitalists, and the whole team for their dedication, resiliency, and the commitment that they have provided as we care for children and families throughout our state. I also would like to thank my adult medicine and emergency room colleagues and teams who have really borne the burden of caring for the sickest patients in their careers during this pandemic. Your efforts are not lost on us as pediatricians, and we have seen everything you're going through. And we pray for your ongoing strength, compassion, resiliency as you continue to go to battle for this community daily. As we celebrate our 5-year anniversary today, we are not celebrating as we had hoped or expected, but rather we find ourselves facing the biggest medical and youth mental health crisis that we have seen to date. The COVID-19 pandemic has certainly impacted each and every one of us in ways we could never imagine. Currently in our hospital, we are facing many challenges. We are seeing an increasing number of children hospitalized for unseasonal respiratory viruses, and our youth are hospitalized with multiple suicide attempts. We have seen more children hospitalized in the month of August with COVID-19 than at any other time in our pandemic. We are facing nursing shortages, respiratory therapist shortages, and other shortages in key positions and departments within our multidisciplinary teams that allow us to provide that effective and efficient care of our patients. We have been full at our bed capacity for most of the summer months, and we are concerned that this trend will continue as we head into the winter viral season. We have routinely been on transfer, closure, and diversion, meaning we are not able to serve all the children in our communities with the specialized care that they need and that they deserve. They deserve the much needed resources within the walls of our hospital. Having a full pediatric hospital is not new to us, as we certainly see this during our winter respiratory influenza and RSV seasons. However, historically, we're able to overflow to our adult units and utilize adult resources during the busiest months of our children's hospital. However, that's no longer the case. Our adult units are full of patients with COVID-19. We have no additional space nor resources to help us offset the busyness of this children's hospital. Therefore, we're no longer assured on a day-to-day basis that these kids are going to get the care that they deserve and need. So I turn to you, the Wichita community, to help us keep our children safe and help us make sure that they have the care that they need. Our young children have no additional protection against this virus other than the multi-layered public health measures that you are familiar with: good hand hygiene, physical distancing, good adequate ventilation, avoiding overcrowded spaces, masking, and vaccination for those who are eligible. Our children are back in the classrooms. Our schools are open where they're receiving in-person education, but we must work together to make sure that they are able to stay. Our schools need our support more than ever to make sure our classrooms stay open. Our school leaders, boards of education members are facing unprecedented challenges and decisions on how to effectively keep our schools open while balancing the safety of our students and their families and their teachers and staff. This should be a time that we support and encourage. I've been encouraged by USD 259 leaders and their decision to focus on safety and the well-being of students, and I hope our other area school leaders will feel compelled to prioritize the safety of our students. I also appreciate our community leaders who have prioritized and implemented policies to help protect the members of our community. Wichita is a town of leaders. It's a town of dreamers, entrepreneurs, problem solvers, and overcomers. It is a town of grit that holds its own. It carves its own path in our state. I miss the not so distant days in our town where everybody flew their Wichita flags high and proud, and everybody was united in our community. We will get through this. We got through the surge in November, December, and January, and we'll get through the Delta surge, and we'll get through any other future surges that happen. But it's gonna take all of us. I would encourage each of us to find ways to overcome and support within our community. Perhaps we should all dust off those Wichita flags, raise them high in honor of our businesses, our school leaders, our city and county leaders as a community, to honor those who are faced with difficult decisions and challenges. We must reunite and work together to keep our children safe, our schools open, and our businesses operating. Governor Kelly, thank you again for being here in Wichita today. Thank you for celebrating our 5-year anniversary of Wesley Children's Hospital. And thank you for our leadership across the state. I'll look forward to hearing what you have to share with us.
Thank you, Dr. Coleman. Thank you, where did you go? Dr. Connie Mckinney. I really appreciate your taking the time. I know how busy both of you are, and for you to take the time to come here to give out such an important message to the people of Kansas is very much appreciated. So thank you for that. And before I get started, I really want to give a shout out to all the healthcare providers who are here today. I want you to know how much we really do care, how much we understand what you've been through these past 18 months. You know, I'm the wife of a physician and the mother of a physician, so I know, and I very much appreciate what you're doing, and I'm hoping that this press conference is giving you at least 10 minutes of relief from your daily grind. So, you know, as healthcare professionals out there on the front lines, your experiences are eye-opening. The exhaustion and the heartbreak, the preventable loss that you see every day, every hour. So please, Kansans, hear these doctors, feel for these healthcare workers who are here today, and then do everything you can to mitigate the spread of the virus and keep people healthy and out of the hospital. Wear your mask, socially distance, and most importantly, get vaccinated. COVID-19 rates in Kansas are levels higher than we experienced a year ago. ICUs statewide are either at capacity or nearly there. Recently, a hospital in Abilene was forced to transfer a critical patient to Wisconsin for the lack of staffed beds nearby. Additionally, COVID-related stress is causing many nurses in Kansas to find other jobs, exacerbating our critical staffing shortage. There are beds available at some facilities like the University of Kansas St. Francis campus in Topeka, but there are no nurses to staff them. It is not too late to turn this around, to reduce infections, to reduce hospitalizations, and to reduce deaths. Vaccinations in Kansas are increasing, but we have got a long way to go, and we need to move, and we need to move quickly. We're using every tool, leveraging every resource to encourage Kansans to get vaccinated. We received the news recently when the FDA fully approved the Pfizer COVID-19 vaccine, and we're all hopeful for full approval for Moderna and Johnson & Johnson around the corner. It is clearer than ever before, and health experts worldwide agree, these vaccines are safe, they are effective at preventing severe illness and at preventing death. We have to do everything in our power to protect our students, our teachers, and our staff in schools. And that's why today, in addition to celebrating the 5-year anniversary of Wesley Children's. I'm also here to announce a new Safer Classrooms work group. We're bringing together a group of highly skilled health professionals, pediatricians, family physicians, school nurses, pharmacists, psychologists. Our speakers today, Dr. McKinney and Dr. Coleman, will serve as co-chairs of this group. The work group will meet weekly to highlight the urgency of protecting our kids from the Delta variant. They'll talk with educators and parents and advocates about their experiences, and they'll use the best available science and information to support my administration, our local governments, and our school districts, so they can promote the health and safety in schools and in our communities. Every week, we will release a school safety report from these meetings. The report will serve as a resource for media, for parents, schools, communities, and policymakers. Information in this weekly report will include timely and relevant policies on testing and masking in schools, and best practices that can be shared across school districts. It'll include updates on school districts with clearly communicated quarantine, testing, and masking policies to ensure that parents and families have what they need to know how to keep their children safe. It'll include information on school district vaccination and testing events with resources to help our schools plan, publicize, and implement. Provide data on youth vaccinations by county, cases, hospitalizations, and deaths. And it will provide a list of schools with active outbreaks. There is nothing more important than keeping our students healthy and alive. The Safer Classrooms work group will help all of us make informed decisions to protect our children and our communities. And finally, again, I want to thank all of the health professionals who will be lending their experience to this work group, particularly our co-chairs, Dr. McKinney and Dr. Coleman. Your work will make a huge difference for countless school kids, staff, and teachers. And I truly appreciate your time, your energy, and your efforts to support this group. And of course, your everyday work to keep your own community healthy. I've said it before, and I will say it again. We got our kids back into school by listening to health professionals, by masking up, by implementing stringent public health protocols, and by getting vaccinated. And we'll keep them there by continuing to follow the best health practices. Finally, before I take questions, I want to implore Kansans to set aside political differences, get vaccinated, and support your school staff, your school boards, your community health providers, and your local businesses. It's only by working together, all pulling in the same direction, that we can defeat the real enemy, the virus, and get our lives back to normal. And with that, I'll take questions. Or not.
Governor Kelly, you said just a moment ago that there will be, I'm assuming it's going to be an administration of some sort of these meetings. Who will these people be composed of? Is it just health professionals across the state?
Yeah, there will be. I mean, you're going to have family practitioners on there, pediatricians, nurses, school health professionals, whether they're in the mental health world or school nurses. So it will be people from the health profession who will be then listening to educators, parents, and others so that they can then guide their own discussions on and provide an opportunity to share those best practices amongst our school districts.
Governor Kelly, other than advising best practices, is there anything that can be done that the state can do to alleviate these numbers that we're seeing in the hospitals?
You know, we are doing absolutely everything in our power as a state to do exactly that, to lower the spread of the virus and to increase the number of people who are vaccinated and to ensure that our kids in schools are safe. I think if you're paying attention, you've heard that we've had vaccine clinics on the Turnpike, and we've got more coming up this week, to catch the Labor Day traffic that will be going through there. Last weekend, I was in Kansas City, Kansas, where 8 churches had come together and put together a vaccine event, and were able to vaccinate 91 people in the course of that day, which is a lot. We are working with Dillon's, for instance. We just announced our partnership with Dillon's, and in select Dillon's across the state, people will be able to get $100 if they $50 for their first vaccine. For their second dose, they get the other 50. So we're trying to use every innovative way that we can to get people to get vaccinated. We're trying to take the vaccine to them. We also, if you watch any TV, you probably noticed that we've got ads on the airwaves, really encouraging people, and particularly our youth at this point, to get vaccinated. That 12 to 17-year-old group is a group that we've had some hesitancy or resistance to it, or just being teenagers, they don't do it. So we're working with them. We're working with our school districts to make sure that it's readily accessible. So we're pulling out all the stops, and quite honestly, we always have been. We keep on adding to the efforts that we're making.
No mask mandates, no mass gathering limitations, none of that anymore.
I want to avoid that at all costs. We know that, when the pandemic first started, a year and a half ago, we didn't know what we know now. Now we know how to slow the spread and how to stop the virus. So we know, I would rather that we go and we implement those procedures rather than other things that we implemented a year and a half ago because it was the only thing we knew to do at the time. We know differently now.
I guess is it feasible to not have a mask mandate when we're looking at these numbers constantly climbing, and of course younger kids being hospitalized with this stuff, and this Delta variant seems to be ripping through our state. Is it feasible to keep doing without any kind of mask mandate?
Well, you know that it is up to the local school boards to decide what it is that they're going to do about masking. A number of them have come in and are requiring masks for both the kids and for all the adults who are in those buildings, and that's a very, very good thing. I think as we see things like, what happened in Wellington, where they started school had to stop. And I know the school board, I believe they're meeting tonight to review what their procedures and protocols will be when they bring the kids back next Tuesday. So they're paying attention, and I'm hoping that, the reality on the ground will drive the policies that those school boards make. But in the event that the school board does not take that step and require masking, then I would turn to every parent in the state of Kansas and just say, you can, it's your kid. If you want to put a mask on your kid, regardless of whether or not it's required, please do.
Last question?
Does your administration have plans for any more vaccine incentive programs, or have you been in talks with maybe other retailers or businesses with some sort of vaccine incentives? I know some states have gotten some pretty amazing ones, and I've seen a couple here just in the state of Kansas. I believe down in Cali County, at one point they were giving away free meat to people to try to get them in the door to get the vaccines.
We are looking at all sorts of options. I think we probably won't go with some of the ones that other states have implemented, which are flashy and whatnot. But when you look at the data, they really don't move the needle. And so we're going to try some other things like this Dillon's approach, where it's sort of up close and personal and immediate. And so we'll see if those kinds of things work. We'll test them. If they don't work, we'll try something else.
Thank you.
And do the doctors have time for a couple questions?
Okay.
Just the easy one.
Sorry that.
Including name spellings, please.
Sure. Do you want me to spell? Okay. Well, my name is Jennifer Bacani, B-A-C-A-N-I, McKinney, M-C-K-E-N-N-E-Y.
I'm Stephanie Coleman, Stephanie, S-T-E-P-H-A-N-I-E, Coleman, K-U-H-L-M-A-N-N.
All right, I guess for Dr. Coleman, you brought up the mental health aspect of this. Kind of explain to people kind of what you guys are seeing and dealing with. I think there's some folks who kind of have missed some of the battles that you guys are facing when it comes to the mental health aspect of this pandemic.
Sure, absolutely. So even prior to our pandemic, we were seeing an increasing trajectory of mental health diagnoses in our teens and adolescents, with depression on the rise, suicidality on the rise. Certainly post-pandemic, or during the pandemic, and now in the situation we're in, we're seeing exponential rise of depression, suicidality in our teens and adolescents, anxiety, lots of anxiety. We're seeing it even in younger kids down to 9, 10 years of age with suicide attempts. It's led to a crisis nationwide. We just don't have the mental health team of experts that we need to be able to adequately provide treatment and care for all these children. We don't have the inpatient beds that we need to be able to move these children out of our hospital into inpatient psychiatric facilities. So it's created kind of a crisis situation for us.
And I guess if you can, what can parents do to help either at least combat this or at least try to realize the signs and get their kids, whatever help they can find for them?
Sure, absolutely. I think, definitely talking to your own primary physicians in your community that you see, and kind of helping to understand the signs and how to recognize signs and symptoms of depression and anxiety in your own children. I think also children feed off their parents, so making sure that we are taking care of ourselves and being good examples for them. Certainly, we have put out some mental health resources. My Kansas COVID Work Group for Kids has a couple of documents that have gone out that have resources on how to build resiliency in children, how to recognize and treat depression, anxiety. So I would certainly encourage them to talk to their primary care physicians about that.
And I guess switching gears for Dr. McKinney, talk about maybe some of the things that you guys are facing in the rural parts of Kansas. I know early on there are quite a few like county health directors who eventually stepped down just due to threats and issues there in their communities. Kind of what are you guys seeing now?
Yeah. So what we found out about public health is that it's actually a very personal thing. It sounds like advice we give to the general public, but in reality, it's very personal and very individualized, especially in rural communities where we're dealing with the people that we grew up with, we're our teachers, we're our friends, people we've known our whole lives. So to give advice as a family physician or as a health officer, and then be kind of questioned about it and actively say, this is not right, the science you're presenting is not correct. It's personal and it's hurtful. We're really just trying to do our best, and in these smaller towns where we each know each other, we each try to look out for each other, that's what we've always done. It's hard to see that happen in a different way, to see us go through a pandemic divided, to see us not look out for each other like we always have. So I'm hopeful that as we move forward, as we see people, we see our friends and family, we see our children get infected with COVID, unfortunately, I hope that does serve to tell people this is real, this is important, and we do need to protect each other.
And I guess has all this experience kind of brought the network of county health directors and providers kind of together, and I'm assuming you guys probably communicate more than what you used to?
Yes, we, prior to the pandemic, I don't think anyone knew what a health officer was. A lot of us became health officers because the previous one quit or died, but that's just small town life. But what we did as soon as the pandemic started, we figured out who we were. We started to talk to each other and talk about best practices, all the science, all the data, figure out what we knew, what we didn't know, how we could assist each other. Because truly in the end, we all, no matter whether we're in an urban area, on the western side of the state or the eastern side of the state, we all want to help each other and help our communities. So, and we really can do that The science is clear, the data is clear. We just need to continue to communicate that to our citizens.
We have time for one more for the doctors.
For the people who have yet to get their vaccine, this can be a general question for everyone. We're dealing with this struggle and strain at the Children's Hospital. Kids are going back to school. There's people who say, I'm not interacting with children in any way. I don't have a student. I don't have a. What would you say to those people who are refusing to get a vaccine but fall into that category that says, I'm not interacting with a child, so I could give a child COVID-19?
Sure. I would still encourage vaccination. So you never know where you're going to be, where you may have an unexpected exposure. The Delta variant is very contagious. It's proving to be more contagious than the original strains that circulated. There's even a case study that just came out of California this week, and I probably shouldn't quote the study because I'm not going to remember all the details, but there was one teacher who was unvaccinated and ended up spreading, I believe, to 24 other people. I think, I'm going to look at Paul because you're my number guy a lot of times, but I think 12 of our own students ended up getting it, and then they went home and they spread it to their families and their parents. And so it just shows you how the power of one can affect many. And so even though you may not be in that position, you never know when you may encounter or come face to face with children in the school or other colleagues throughout the school.
Thanks, everyone.